3-minute interview. I'm with Dr. David Carr, who's an expert in COVID. New Zealand has no cases of COVID now, and they have sports activities and audiences. Is Canada, is Toronto lagging behind as far as public health and the measures we've taken?
I think we'd all want to be in New Zealand. What a wonderful, powerful women's leader. I think the issue is it's a different place. It's an island. And they were very quick to respond, but just by their national typical landmass, they've had an easier time controlling the border. Remember, we have a border with a country that is really struggling with COVID-19.
So should we have shut the border down immediately? Do you think?
I think hindsight's 2020. I think we should have, the people who cut earlier did better.
Let's talk about, you're a doctor then, let's talk about the medicine of COVID. Are we going to, moving forward as a society, get an answer to this so that we can be out and about again in the near future?
I mean, there's no secret sauce in terms of treatment. Nothing is really making the impact. Study after study keeps getting rid of treatments. I think the issue is we are delaying and controlling until we have a proven vaccine.
What do you see then as a future of social interaction for the next year, next 2 years, until we get that vaccine? Are we going to be hamstrung?
I think it's going to be different. I think the future of air travel, I think the future of watching mass gatherings and sports events is different. I think we're all going to have struggles as we adjust, because this is the new norm, without a lack of a better term.
Some social commentators are saying if there's any good thing out of this, it's the fact that there's been attention given to retirement homes, old folks' homes, which were infected.
Yeah, 81% of the deaths in this country are in long-term care. I think the way we approach homelessness, I think the way we approach long-term care, there's going to be a new lens looking at this. There's going to be major changes.
Are you experiencing any kickback from people who are saying, I've had it. I'm just tired of politicians and public health officials telling me what to do?
Yeah, there's an alarm and caution fatigue. People are burnt out with this response, and I get it, and it times perfectly with beautiful days like these. It's only normal. It's only natural.
Is there going to be a long-term effect on, we talked before about children and the fact that they have missed half a year of education, if indeed they get back in September, they have missed summer camps, they have missed sports, they are missing socialization. Should children be working and getting close with each other?
Getting ready. I think there are a lot of victims, and I think mental health, joblessness, we know that as unemployment tends to rise up, suicidal rates, depression, intimate partner violence, there's a lot of bad things to talk about. Kids are one of the victims, for sure.
Okay, so there's a lot of bad things to talk about. We don't want to weigh on that, but people watching this are going to be saying, okay, well, what's next? I know that you're not a futurist, but Dr. Carr, tell us what you anticipate next for our society.
What's next is we have to learn to reintegrate. We have to move forward. We cannot have all the other untold victims, the people waiting for their colonoscopies, their screening tests, waiting for hospitals, waiting for surgeries. We have to move forward. We just have to keep an eye as we do it.
Why were surgeries? I've spoken to a few surgeons who say, we don't understand why surgeries are canceled. And people have died because they've been lacking in surgeries. Why were the surgeries closed down?
I think we were worried about what we had in terms of PPE, in terms of hospital space. And when we did a pandemic plan, we didn't know that we could accommodate elective surgeries. I think we're now opening things up, and it's ripe, it's ready.
Okay, Dr. Carr, good information. Thank you.
Thanks so much.
Thank you for watching. Our next broadcast, we're going to be dealing with policing in Canada, politicians in Canada, race in Canada. For the LeDrew 3-minute interview, my name is Stephen LeDrew.